My name is Amanda Bolderston. I'm a radiation therapist and researcher, and I work at the University of Alberta in Canada. And also I co-found and run an organisation called Queering Cancer. So I'm here to talk about a couple of things about the experiences of healthcare professionals coming out in the workplace as queer, trans and non-binary, but also the running and the work of Queering Cancer, which is an organisation that supports patients who are trans, non-binary and queer, having healthcare or having radiation therapy or any kind of cancer treatment. I wanted to kind of highlight those two things, and I have another couple of talks. One is on qualitative research, which I'm very passionate about and kind of underpins a lot of what I do. And the other one is about weight bias, and that's a sort of growing area of interest, specifically in radiation therapy and medical radiation sciences. There's a lot of implicit weight bias in some of the research that we do, and it's just sort of an emerging area of research, and we kind of need to do better. So I'm talking about a scoping review that I'm part of as well. So a few different things that I'm here for. Things have definitely changed in the last 5, 10, 15 years, but traditionally people are sort of reluctant to come out at work in general. And healthcare is quite a conservative environment. And I know from my personal experiences as a radiation therapist, and I'm a lesbian, and when I was clinically working, I always felt sort of uncomfortable with my sexual orientation at work. But I also recognised LGBTQ patients, and sometimes they would come out to me and I felt like I could offer some support, by sharing my identities like we would share any kind of identity at work. But because the identity is very stigmatised, it doesn't really happen, or it didn't really happen very often. So I was interested in seeing, is that still true? How is it working out now? Do people come out at work? How comfortable are they? And do they offer support to patients? And in terms of has it got better, the work that I'm doing in Canada shows that a lot more people are open with patients. There's a lot more back and forth and communication between patients and healthcare practitioners, so there is some support there. But having come here, we've been talking to people, and there's some really lovely examples coming out of workplaces in and around Sydney where they have an amazingly inclusive workplace where staff are really comfortable and out, and their interaction is happening. And it seems to be, the management may be queer, and the management are able to support people, and there's investment from leadership into diversity training and things like that. So sometimes it seems a little bit bleak when you're looking at the negatives, but coming here has sort of opened our eyes a little bit, because out there are some really good and amazing models of care happening. So it's been great in that regard. It always seems to come down to education and communication. And I think we don't really talk about it much, but when we do talk about patients, fat patients, so I sort of use the word fat as a kind of neutral descriptor, but fat patients tend to be seen as a problem. We look at it as an issue. They take longer to get on and off the bed, people say, and we've got weight limits on our equipment, and we have sort of biases towards fat patients. And you really see that in the healthcare literature, like everything's written from this kind of negative perspective. So what I wanted to do with the research was sort of, with a group that I'm working with, was to sort of highlight that, to take a look at the research that we're doing and saying we need a more positive lens to the research. And there's nothing out there from the patient perspective. There's a lot of qualitative research that asks therapists, for example, what do you think of obese patients? And the therapists come out with some preconceived ideas and some experiences that they've had, but no one's asked the patients and said, how do you feel coming into a radiation therapy department? Do you feel comfortable? Do the chairs fit you? Do the gowns fit you? Has anyone made you feel uncomfortable getting on and off the bed? Do people reassure you? Are people compassionate? Like, those are the kind of questions we need to ask. So at the moment for me, it's more about the research, like what are we asking and how are we asking it? And I think that kind of brings change, right? So you start to do the research, people pay attention, and we've been hearing about evidence-based practice, and then you can take that evidence and implement it in the departments. I would totally recommend this conference. I mean, it's such a big conference, there is so much going on, but in terms of research, quite often you feel like you're doing it in a bit of a void. You publish stuff, but you're not really sure if it makes an impact. People come up to us in terms of, the LGBTQ2 research that we've been doing. We've had a lot of queer healthcare professionals coming up and checking in with us and connecting with us. And again, it sort of affirms the fact that the work that you're doing is worth